Oh, here we go.
Okay. So we have a little bit of a extensive agenda, but we'll try to get through it as quickly as we can. So perhaps we can give you back some time this morning, which is always a nice thing. As we had mentioned at our last quarterly meeting, we refreshed the logo, and you can see the refreshed logo on the slides. It's now just a gradient of blue and aligns with our Suburban Hospital Alliance and Nassau Suffolk Hospital Council logos and the way that they're presented for a more cohesive look. And we thought, since we're no longer under the strictures of the state, that we would have a fresh start, sort of. So that's why we did that. We're also updating the website with adding content and removing content as we move along. So that's a process in place. When we get a few minutes here and there, Brooke and I go in and make some changes. So I thought maybe I would just bring you to the website if I can. Can I get there, Brooke? Open.
You should be able to.
Can you, does everyone see it?
I don't see it.
No? All right. Well, that's okay. I don't know why it's open on my end here.
I think under slideshow, if you go start from current slide, you should be able to click on that.
You know what, Brooke, you take over from here. I'm getting all confused.
Okay. Let me just pull up the presentation here. Okay, can everyone see this?
You can see the presentation.
It's the
Great.
presentation. It's not pulling up the
Okay.
link. Because we'd have to stop the share.
Okay,
And
so
then-
you can't see the,
No. We'd have to stop the share, I guess, and go back and forth, but we don't have to do that. It's okay.
okay, so now I think you should be able to see.
There it is.
So you'll just see we have this blue kind of in place of where we had our green. And we still have the green as an accent color, but this is to just kind of give you an overall glimpse of what the new site looks like.
Yeah, and we're slowly moving through it. As I said, when we have some free minutes, we go in and we do some updating. Just wanted to bring your attention to that. It's flu season almost. Well, it is flu season. And so last year, the Collaborative and the Nassau Suffolk Hospital Council jointly sponsored a flu vaccination campaign. And we're going to be dusting that off and doing that again this year. Last year, we were fighting against the potential onslaught of a twindemic because we did not have a COVID vaccine back then. And we were urging everyone to get their flu vaccine to eliminate at least the threat of the flu from the COVID situation. This year, we have both vaccines. And we'll be urging, as we've been urging everyone to get their COVID vaccine, we'll also urge flu vaccination. And that'll be happening early October. I believe I heard from the FDA that they're recommending everyone get their flu vaccine by October 31st, so by Halloween, to avoid any kind of surge that could happen with the flu, although I haven't heard much about the flu other than get your flu shot. So we will be rolling out a campaign. I believe the campaign, we're going to make that customizable, Brooke, with logos.
Yes.
If not, if anybody's interested.
Yeah, there will certainly be opportunities to co-brand
Yeah.
on that campaign, and you can just reach out to us directly once we release that.
Okay, let's go to the next slide. As I had mentioned also back at our June meeting, that we unveiled a new service under the direction of the Suburban Hospital Alliance of New York State, of which the Nassau Suffolk Hospital Council and the Northern Metropolitan Hospital Council are a part. And this is geared toward community-based organizations, public health institutions that are on very, very tight budgets. And it provides a menu of services, health communications, marketing services. And it kind of grew out of inquiries that we received here at the Long Island Health Collaborative regarding assistance with health communications. And so we saw it as an opportunity to put together something more formal. And we do have a couple of clients in hand already. And just wanted to remind you about that. It is very competitively priced. And there are some menu options, package menu options to choose from, which makes it easy for a CBO to, when they're doing a budget, to know what exactly they're going to spend and what they're going to get. So just kind of keep that in mind. You can see what we do there. And so there's a social media component to this as well that we offer.
And all of this information you can find on the Suburban Hospital Alliance site.
Yep. So that's where that is. So just wanted to bring you up to date on that. And a little bit about some upcoming events that the collaborative is sponsoring. You know, we continue to be a Walk Safe with a Doc chapter here on Long Island. We are coordinating with one of the collaborative partners, the New York Coalition for Transportation Safety, to hold a town hall event, Walk Safe Long Island virtual town hall event, all about pedestrian safety, bike safety. But I think, did you skip the Walk with the Docs, or are they next?
Nope, I think, yep, we have our Walk with the Doc right here.
That's where Walk with the Doc is. So Walk with the Doc, again, is a chapter that we maintain here on Long Island through the Long Island Health Collaborative. And we have 2 walks coming up, and we call them Walk Safe with the Doc, because again, we're partnering with the New York Coalition for Transportation Safety. And so we have a physician who gives a brief 5-minute talk on some kind of health issue. And then we have experts from the coalition lead individuals on a walk in a downtown area, pointing out safety hazards. Perhaps there's not a walking crosswalk light, or there's not a curb cut, or whatever it might be. And they point out different laws that are in place to protect pedestrians and bicyclists who are on the roads or out and about walking. And that just kind of illustrates opportunities for other partners if they wanted to join with us and participate and hold a walk with a doc. We're happy to do that. Some hospitals have done that. Some other community-based organizations have done that. And the beauty of it is that you just pick a date and a place, a location, and we handle everything from there in terms of setting it up, the promotion, getting the physician. And it's nice. It's kind of a nice co-branding opportunity for CBO, for a hospital. So just keep that in mind. It is the Walk with the Doc is a national movement. There are chapters all over the country. In fact, I think it is international at this point. So there are chapters all over, and we're lucky enough to have one chapter here that's been quite active now for the past couple of years. So just keep that in mind if you ever want to hold a walk. We even do pre and post surveys, so you can have some intermediate measures of success to put in your back pocket for when you have to do any kind of reporting. And next.
Just another note about the town hall. It's going to focus a lot on micromobility devices. If that's something that's of interest to you, please consider joining and just kind of sharing your opinions. We would love to have you.
Yeah, micromobility are those motorized scooters and
E-bikes and whatnot.
bicycles and e-bikes that are not governed by any laws at the current point in time. And they're becoming much more popular here on Long Island. They're very popular in New York City. You've been in the city walking around, you've seen them zooming in and out, or if you've been driving in the city, you see all of a sudden they creep up on you. And it's quite dangerous, but it's almost like the Wild West. So I think there's probably going to be some movement to regulate that in some way, but there currently isn't. So that webinar or town hall is going to explore that specifically.
Yes.
Somebody says, my wife takes her e-bike to work most days. Well, I hope that she's safe, where she's, has a safe path to travel.
And there are so many benefits to those,
Yes.
Electronic
Yes.
vehicles. So we'll be discussing both pros and
Yeah.
cons at the town hall.
Right.
So
The hospital,
will that include like for those who are disabled? Like, is that the focus, or is it like people who do use micro whatever for sports?
More like recreational vehicles, like city bikes and things of that nature.
Okay, all right, thank you.
Sure.
what are you referring to, like motorized wheelchairs? Is that-
Yeah.
Well, I don't know that they're going to specifically talk about that, but that is a good point to
That's a
bring
good
up.
point.
I would think that falls under micro mobility because it is motorized form of transportation.
Yeah, I mean, I was just thinking of sending this, the information to a colleague who works in, ensuring appropriate services for people with disabilities. So
That would be a great voice to have,
Yeah, that
during
would
the
be-
town hall. So please do.
Okay.
yeah, that would be a great voice to hear from, because certainly that's what the point of the town hall is, to hear from the community what they're facing. So please do send that along. And I'm going to mention that to the director of the coalition, because I don't think anybody's given that any thought. And it's a great, is that Linda who brought that up?
Yes.
Thanks, Linda.
Okay,
Very-
thank you.
Always an astute observer, always.
Thanks.
For the hospitals and the county health department representatives who are on the call, you know that we're beginning our work on the community health needs assessment that needs to be filed, that extensive plan that needs to be filed next year with the state. December 31st is the deadline, 2022. This year it's an update filed by the end of this year. And we've put together a work group of hospital members, county members, and I believe some community-based organization members are also in that work group. And we had our first meeting in September, on September 1, really just to talk about our approach to how we're going to assess the needs of the community, and all of that information. A summary is online, as well as a recording, if you so choose to want to listen to the recording. I suggest you just read the summary because it's pretty much the recording, and that'll help you to understand where we are. For hospitals, there's also a federal requirement that they complete a community health needs assessment and file it with their IRS Form 990 Schedule H every 3 years, this extensive form of plan. So it meets that requirement as well. And we will be having meetings the first Tuesday of every month moving forward through, I think, April of next year. They're virtual right now. At some point, maybe we'll be in person again, but for right now, we're still virtual with those meetings. And we are right now talking about, we're looking at the Community Health Assessment Survey, which is that tool developed by the collaborative and its partners way back in 2013, and now has about 13,000 respondents to the survey over time. We're looking at that survey once again, perhaps maybe tweaking it just a bit, And then we will reach out to community-based organizations through a separate survey, just the community-based organizations leaders, to ask them what they're seeing among the patients and clients they serve in the space of healthcare services and social services, so that we are adequately representing the social determinant of health needs. And since collaboration is key, both from on the state level and the federal level, right? They want the collaboration to be demonstrated in this plan, in the community health needs assessment, and then the subsequent plans, community service plan for hospitals, community health improvement plan for the counties. They want to see active collaboration with organizations in the community, because we cannot do this work unless we do work with organizations in the community. So just wanted to emphasize how vital those community-based organization partnerships are, both for this process where we're seeking input and for the work that's ongoing. And the next meeting is Tuesday, October 5th. So anyone who's on that work group should have already gotten the summary and the information to register for the next Zoom meeting.
And these
Just wanted to
slides
let
will
you-
be, oh, sorry. I was just going to say that these slides will be available online, and this link here will allow you to register for those meetings if
Yep.
you have not already.
Okay, so
So speaking of collaborative effort, as Janine mentioned, it's really important that all of us do work together to distribute the community health assessment survey. You know, the data that we get out is only as good as the data we put in. So we created just a little toolkit to kind of lay it all out. An unexpected error has occurred. Okay.
of
Well,
course,
we also sent it out to everyone before the meeting, and I can certainly put it in the chat here. I'm not sure if I have it open, but it's just a little toolkit of social posts. You know, we have sample text for you. You can just copy and paste and stick your organization in there. And we have some graphics that we just want to make it as easy as possible for you to share the survey on social media so that we can get, you know, as many responses as we can. And the collaborative is also going to be boosting the survey on Facebook, just putting a little bit of money behind it to boost it to those target zip codes that we have identified in the past.
there's
Lisa
a
has some
question.
questions.
This question in the chat from Lisa. I think you're referring to the community health assessment survey. You're asking if we ask for zip code,
Which we certainly do, yes.
which we do. Yes, it's down to the zip code, which makes this survey analysis and the results very useful because it is zip code based.
And,
One,
what
I'm
is the
sorry.
what's your goal for samples or response? Like how many people would you feel happy with?
I'm not an epidemiologist, so I'm not sure what the statistical number would be that is valid in terms of a sample size. We really have just been dependent upon collaborative members, hospitals, anyone involved, circulating the paper-based survey and or the link, and hoping we get as many back as possible. We've had a couple of thousand come back some years. We've had other years we only get 500. Like last year was not a good year because of COVID. There were not a lot of programs that were operating. I think the more we get, the better. What we are trying to do is we want to make sure those high need communities are better represented. So we're putting money behind boosting the link on some Facebook posts in those selected zip codes. And if you look at I think it's like 10 or 12 in Suffolk and 8 or so in Nassau, so that we get more representation from those areas. So I don't know what, I can't say what the number would be, but as I said, it's been a couple of
Okay.
thousand some years, 500 other years. So if we could get 3,000-4,000, wouldn't that be great? As many as we can possibly get.
And then I just want to show you guys the toolkit just so you know what it looks like. And this will be available on the website along with all the other meeting materials. And you'll see that we just have some sample posts here. If you would like to have your logo added to these posts, please reach out to me and we will get you those co-branded posts as soon as possible.
You know, ideally, we hope that people will fill the survey out via SurveyMonkey link. But that's, if we have to take paper-based surveys, we're happy to do that. And then we input the data here. We just did a whole bunch of surveys, a couple of hundred came in. So
Shout out to John Perkins.
John Perkins from Catholic Health. So we're happy to do that. Obviously, it's better if it's done electronically, but we'll do it any way that we have to. Okay, so what do we have next? Any other questions about that before we move forward and speak to some of our colleagues who are going to talk about suicide prevention? Does anybody have any? No. Okay, well, I had oh, here's a question. I'm sorry, I'm squinting. I am telling you, I cannot see this man. I apologize. Oh, somebody's jumping off. Okay, goodbye. Sorry to see you go. I had the idea, since this is Suicide Prevention Month and next month, October, is Mental Health Awareness Month. And given the fact that we've seen such an increase in depression, anxiety, and other substance use disorders and other related mental health disorders due to the stress and disruption of the pandemic, which seems like it's never going to end, I thought that it would be prudent to hear from a few of our collaborative partners who are working in this area. I did send out several communications prior to this meeting, offering the floor up to anyone who's working in this space to speak for a few minutes about what their organization is doing. And we had 3 individuals respond. And I think it's important, as much as we want the public to know what you're doing, it's important that each of us know what the other organization is doing, because that is collective impact at its finest and at its best. So we're going to hear from 2 individuals. I understand, is it Amy or Ann who had to? It's
Anne,
Ann, right?
unfortunately, had an emergency. Yes.
Yeah, Ann had a work emergency, unfortunately, and can't give us a quick overview, but her contact information will pop up on her slide when we get there. So we're sorry that we can't hear from her. So we'll hear from Amy Miller and from Tara Fredericks. And first will be Amy Miller from the Veterans Affairs Department. She's heading up a new initiative. She did reach out to us a few weeks ago, and certainly we know suicide is very, very high among veterans, and we don't want to see that. And she's working very hard, and she wants to connect with other community partners to bring that statistic down. So Amy, I will leave it to you to speak a little bit about what you're doing.
Great, Janine. Thank you so much. Good morning, everyone. So my name is actually Amy Milheiser. I know it's a mouthful. I am the new Community Engagement and Partnership Coordinator for Suicide Prevention at the VA here in Northport. And many of you probably know that on average, 20 veterans die by suicide each day. What you may not know is that only about 6 of those are actually recent users of VHA care. Not everybody knows that. So the VA has decided to take a more public health approach to reduce these numbers. Personally, I think we're a little late to the game, but they want to engage the community agencies and our community partners to come together in coalitions to work to improve the numbers so that we bring those numbers down and we do better for our veterans. The approach that they're sort of rolling out and the focus, as you can see on the slide, is to identify service members, veterans, and their families and screen for suicide risk. The second focus is to promote connectedness and improve care transitions. And I, for one, personally, I was a hospital social worker for many, many years. And When we had veterans come in, it may be improved now, but I know personally when a veteran came into the hospital, we sort of shrugged. We didn't exactly know how to connect them, who to contact, what they were eligible for. So I do know that improving those transitions from different places of care can be so vital to their success. And then the third priority is increase lethal means safety and safety planning. I'm sure many of you maybe in the mental health arena are used to the safety planning and increase lethal means safety. That's about increasing the length of time between the suicidal crisis and the access to the means. That's what saves lives. So the focus for the VA is to pull the community agencies together. It can be a faith-based agency, it can be a mental health agency, healthcare, education, our veteran service agencies, any agency in the community that serves our veterans, we want to hear from, we want to pull them together so that we can work together to come up with action plans and bring these numbers down, if not eliminate them entirely. So please, I apologize. I realized on my slide I'd left my my email address off, but my phone number is there. My email is very easy at the VA. It's my first name, amy.milheiser@va.gov. Please, if you're interested or you hear this and you think you know the perfect person that would want to be involved, please send them my way. My first kickoff meeting for a coalition is late tomorrow. But there will absolutely be more. And if you're interested in attending tomorrow, I will make sure that we get you added. Otherwise, there'll be more coming in the month of October. So please don't hesitate. Any questions or any interest, please reach out and let me know.
And Amy, we can add your email information into the chat so everyone
Oh,
has it.
thank you so much. I appreciate that. I looked at the slide and I cringed. I said, oh no.
Yeah.
I appreciate that, Janine. Thank you.
Sure, we can do that. And thank you for participating and
Thank you
what
for
you're
having me.
doing. This is very important. It's very sad what's happening to the veteran community. And so we appreciate what you're doing. And I know there are other partners on this call who would certainly want to join with you. And so that's the whole beauty again of the collective impact approach.
Yes.
I'm sure you'll be hearing from some individuals.
Excellent. Thank you so much.
Okay, there it is. There's your email address.
Perfect.
Okay, thanks, Amy. Next, as I said, Anne from the Long Island chapter of the American Foundation for Suicide Prevention did have a work emergency and we cannot hear from her today, but there is her contact information. I'm sure you're all aware of what her organization is doing. It would have been nice though to hear from Anne, but we hope everything works out with her work emergency. Next, we will hear from Tara Fredericks from the Association for Mental Health and Wellness. Hi, Tara, how are you?
Good morning. Thanks, Janine.
Good
I'm well.
morning. You're going to talk about a specific project, Project Hope.
Yep. Yeah. So good morning, everybody. I'm the Director of Special Projects at the Association for Mental Health and Wellness. And I just wanted to take a couple of minutes this morning to really share with you some resources that we have through one of our special projects, which is Project Hope. So what we found, you can go to the next slide, but what we found is essentially there's been an overwhelming response, obviously, to COVID that has been described as a perfect storm for suicide mortality. So essentially, we're seeing, the pervasive anxiety and depression that's collective across our community, economic stress, lack of access to mental health care, and then a sense of isolation and separation from our communities and from our resources that's really putting more people at risk. So on the next slide, you can see Project Hope is a statewide initiative, and we are one of the partners on Long Island, and we have 3 teams that provide individual or family-based crisis counseling services. We do have community education and support groups, and all of our services are free, confidential, and anonymous, and they're accessible to anybody in Suffolk County. So we have been able to connect with school districts, with hospital settings, other mental health or other healthcare providers. We've connected with day camps over the summer, as well as individuals and then other community partners, food pantries, food banks, stuff like that, to really kind of get the word out that there's support available. On the next slide, you can see some of the resources that we can do. We do information and education. We can connect individuals to resources. And like I said, we can do one-on-one counseling with them as well, virtual and in person, depending on the individual's preference. We also do some education and resources. So if you have a staff group who either would like to be able to better support the clients that you're serving, or who need some support themselves, whether it's around self-care, stress management, dealing with being caregivers or providers in this setting, we can come in and do a series of workshops, a single workshop, or even a support. On the next slide, I have the information about our helpline as well. So we have a helpline that's available from 9 to 7, and we also do callbacks outside of that time if anybody needs them. So people can call right in. They're connected to one of our trained crisis counselors. We have crisis counselors available to speak with people in both English and Spanish. And again, they can get support or link to resources right over the phone as well. The final slide just lists some other available resources that are always available through Association for Mental Health and Wellness. So again, if you identify somebody who might be struggling or who could benefit from being connected to additional resources, you can send them our way. Or if you're a provider or a community resource and you need some linkages to mental health services, you can reach out to our mental health helpline, which also has a provider directory available. So that's it.
Thank you. Any questions for either Tara or Amy about what they just presented or what they're doing? No. Tara, I'm sure that you have been deluged with calls to that Project Hope hotline and people seeking services as they deal with the stressors of this COVID and this pandemic. I'm assuming that that's been pretty busy.
It has been, and really any of the services or community ed that we do in person, we get a big response. I think people are just looking to be connected and not necessarily remote. So
yeah. Well, let's hope as vaccination rates continue to improve, that we will get beyond the situation that we're in. I'm not even going to go into the vaccine mandate that's going to go into effect on Monday for the healthcare workforce, particularly hospitals. But aside from the legal challenges that are sitting out there, but let's just hope that as we move forward, that the vaccination rates, which are pretty good in Nassau and Suffolk overall, let's just hope that those rates continue to move up here and throughout the country so we can get past this. So we're going to continue our quarterly meetings as we've been doing. I talked about the Community Health Needs Assessment Work Group that's began meeting and will continue to meet every first Tuesday of every month. And that information, as it's analyzed, and we analyze that information twice a year, and it's all available on our site. It's such great information for and data that to inform those community health needs assessments, obviously, but also to use when you are determining resource allocation. You know, you can see where the higher need area is and what are some of the responses, what are they looking for. It'll be interesting to see if concerns about vaccine or vaccine preventable diseases rises to the top this time around when we do the analysis, if that's on people's minds. But this information is also very useful for the small community-based organization. You might be using this for grant applications to help support the work that you're doing and to help also for you to direct your resources and programming in the future. So we have that available to everyone. We, in addition to the community-based organization survey that we will send out to key CBO leaders, we are thinking of holding some key informant interviews with community-based organization leaders and putting together an analysis, a qualitative analysis of those responses. So that would be a supplement to the quantitative data that we would be able to obtain through the survey. And again, that's open, that's available to everyone to use. I can't believe that I think I got through the whole, is this like the last slide? Yes, it's the last slide. So I told you I'd give you back some time, and I'm giving you back quite a bit of time, So we next meet again in December. I think it was December 9th was up on the screen. Again, it will be virtual. As soon as I can make these in person again, I'd be happy to do that. Kind of all depends on guidance from the state, CDC, FDA, White House, what they say we can and cannot do. And I'm sure you're all dealing with that as well. Is there any topic for discussion that individuals would like to bring up now? Anything at all related to both what the collaborative is doing, the vaccine, the situation we're in, the pandemic, stresses you're feeling, anything that anyone would like to share and talk about, ideas for moving forward?
This is Dr. Mermelstein. I just have a quick plug for our community cancer needs assessment. I put it in the chat. It's sort of an extension of the needs assessment that the Long Island Health Collaborative is doing, but we're looking specifically for information about people's concerns and on cancer in Long Island. So we need to know what the cancer burden is to be able to try and address it. So if you can complete the survey, it's in English and it's in Spanish. Again, I gave the link for it. That would be really helpful to us, and share it with your constituents.
Linda, now that's an ongoing survey, right? Because I know I completed that survey many months ago.
Yeah. Yes, it's like once a year if you're going to do it more than once.
Right. So when will you be tabulating results, and are they available to everyone?
There's no deadline. It's rolling, and we haven't yet done a tabulation, so we're just in the collecting phase at this point.
Okay.
So, probably by then.
But will it be available for instance, like collaborative members to take a look at the results?
Sure. Yeah. Once we have them, we can share them.
Okay. And if I recall, if my mind is right and I recall correctly, I think when we did the analysis of the 2020 Community Health Assessment Survey data, I think I recall seeing concerns about cancer, both in the individual concerns and concerns for the community, way up there. Might even been number one in one of the counties.
I think it was. So this just drills.
It's always number one.
It's always number one.
And heart disease is hardly on the page, which is shockingly disappointing.
Yeah.
Just one question about this survey. I know you said it's ongoing, but someone has a question. Is there a deadline?
There is no deadline.
Excellent.
Yeah.
Okay.
Okay.
And I see Karen has her hand
Karen
raised.
has her hand raised. Karen.
I'm on my knees. Hi, everyone.
Karen.
Jane and Brooke. This is Karen Kirschbaum at Western Suffolk BOCES. And I think from 2 meetings ago, we were concerned about our continued funding from New York State Department of Health. So I'm just happy to let everybody know that as of June 1st this year, we received at BOCES 3 New York State Department of Health Creating Healthy Schools and Communities grants. So many of you know me from the prior meetings. We're focusing on 3 different townships. So the role of our grants has expanded tremendously. We'll be working with Town of Babylon, Town of Islip, and Town of Hempstead. And the focus of the grant still is nutrition and physical activity, increasing opportunities for physical activity such as the walking event taking place Saturday in Wyandanch, and increasing access to affordable, nourishing foods. Previously, we worked closely with a few school districts, and now we can really expand, with time and relationship building to communities in the townships, Babylon and Islip and Hempstead. So our current work will continue in Wyandanch, Brentwood, and CI, and then we hope to expand to, in Amityville, Copiague. So I just wanted to let everybody know we have relationships with some of the schools, but we'd like to build that, and the community leaders as well. And a couple of areas that changed with these grants are now we'll be working also with the child care education centers through our contract agencies, Child Care Council in Suffolk and Nassau. So similar to what we were doing at the public school level with nutrition, physical activity, now it's extending down to the early child care and pre-K levels, which is awesome. And we're working closely with both child care councils. We're continuing to work with Vision Long Island because they have connections in many of the communities, and they focus on complete street and walkability and pedestrian safety. So we're happy to have our grant partners. And in the chat earlier, I just introduced, we have a new staff person. She wants to come say hello.
Hello, new staff person.
This is Callie Vitalo, started Monday, and we have a social work intern from Stony Brook, first year, Samantha Wood. So we have an office full of people.
Excellent.
And one other thing, there's more of a focus on community in these grants. So working with work sites, and a lot of it are initiatives that have been established through the Long Island Health Collaborative, the library work, but we're going to be building on this, on work sites and community settings. So if anybody has any questions now, or email me.
What is your contact information?
We can put it,
I'll
we'll
put it in the
put it in the chat.
Perfect,
We'll
thank
put it in
you.
the chat.
Put it in chat. Karen, great to have you back. She was kind of retired. She didn't really want to be, and now she's not retired anymore. So great to have you back. Just want to make one connection about what Karen is doing. And she mentioned that Long Island Health Collaborative has been active with Western Suffolk BOCES and the grants in the past. But it's this Saturday, the 25th, just kind of show how the collaboration can work, even if you think your organization is not related to another organization. The Walk with a Doc, we were able to combine the Walk Safe with a Doc. So that's the New York Coalition for Transportation Safety with their pedestrian safety law experts, along with a doc from Northwell Health, who'll give a few minutes on primary care health and probably talk about I would think obesity and cardiovascular disease issues. It's actually the third time she's doing it for us, is hosting one of the walks and leading it. We're doing this in Wyandanch, and it kind of all came together with these two organizations now that are connected with the collaborative. Karen's organization, the New York Coalition for Transportation Safety, and then the town of Babylon, and a festival, if I get it correct, it's at Ujamba Festival that's happening there in Wyandanch as well on Saturday morning. So it's kind of all came together, and one organization is able to take advantage or to capitalize on the skills and specialty services of another organization and pull it together again for that real collective impact and action example. Now, somebody had their hand raised. There were two hands
Stephanie.
raised. Was it?
Kubo.
Hey, Stephanie, how are you?
I'm good, thanks. How are you? It was related to Karen's comment. Just wanted to mention that Northwell, it hasn't been officially announced yet, but is going to be doing a lot of work around youth programming in some of the areas that Karen mentioned, and would certainly be interested to see if there's any synergies. One of the things that we will be looking at as a part of that is diabetes and obesity prevention and intervention. So Karen, someone from our team will connect separately if that's okay.
Karen, are you still there? I'm sure she's happy to hear that. She turned her camera off for a moment. And
yes.
there was,
hi, sorry, we're here. Karen stepped out, but I got it.
okay. And there's another hand raised, I thought. Did somebody else have a hand? There was said 2 hands were raised.
Shanaz.
Shiraz. Sure. Go ahead.
Hey everyone, good morning.
Hi there.
Did I get that correct?
Good morning.
Shanaz, yes.
Shiraz.
Shanaz Singh with Greater New York Hospital Association. I just wanted to mention that we are updating our monoclonal antibody treatment listings. For those of you on this call, you may already be familiar. These are new therapies that are available to prevent hospitalization for any individuals that have been diagnosed with COVID-19. So we are maintaining a list on our website of all of these locations. And so I will leave the link in the chat in the event that your organization has to update your listing or has any information if you have started to offer the therapies. And so any information is greatly appreciated. And please feel free to share the listings with communities or in newsletters, whatever platforms you have available. Thanks, everyone.
Great info.
Thank you.
Thank you.
I did also see in the chat that Teresa Jacobellis with iPro called attention to the fact that next month is also Health Literacy Month, and that iPro is going to be offering some helpful tips and information related to that. Teresa, did you want to say anything else?
No, it's only my first meeting, so I'll be quiet. So, and I'll let everyone go.
You've been
no, but we're new to the collaborative. We're very eager and looking forward to working together with everyone here, and just interested in hearing what everybody's doing in some of these areas.
Thank you, Teresa. And IPRO stands for Institutional Peer Review Organization.
It used to stand for Island Peer Review Organization when we started 35 years ago, but we don't really, we've moved so far beyond that scope that we just use IPRO now. And we're the second largest contractor with CMS. We do work with the Quality Improvement Network and Quality Improvement Organizations, work with hospitals on quality. So just basically a healthcare quality consultant working with, I think, 35 states around the country.
Wow. Excellent. Anyone else have anything to share or they would like to talk about? Again, we heard from Stephanie Hugo from Northwell, and she's going to reach out to Karen Kirschbaum, right, from Western Suffolk BOCES. And that's kind of the beauty of the collaborative. It's been able to pull these partners together the course of the past 8 years or so, and there's been really some fantastic work that has come out of it. I don't know if Lisa Ben Scott is still on the phone, but the library program, right, the library research that the collaborative and Stony Brook University, Delphi University, and Hofstra University, not doing the qualitative interviews, but they were involved as well, has been a fantastic partnership and has resulted in some really good research results that will be released formally in the next couple of months. I don't know if you wanted to talk a little bit about that, Lisa.
So the work that Janine is referring to is a needs assessment to understand how the public libraries address the social and behavioral determinants of health, the health and social needs of the communities they serve. And, we learned a great deal. Libraries are amazing resources to communities. They meet people where they are, whether that's with programming that supports survival or programming that enriches communities' lives. But over the last 2 years, Stony Brook has used a lot of what we learned from that experience to create a new program. It's called the Healthy Libraries Program. We are currently collaborating with 8 public libraries in Suffolk County with teams of nurses, PAs, public health students, health science librarians, dietetic interns, and social workers working together on site. Patrons can walk up and get a blood pressure screening. We have a partnership with the American Heart Association of Long Island, and Michelle Gervat, who's here, was instrumental in championing the AHA's relationship. All of that happened because of the Long Island Health Collaborative's networking. And last year during the pandemic, we had several weeks in the library, and then we pivoted, just like everybody else, to remote delivery. But we had over 900 encounters with our team, providing health information, referrals, connecting patrons to things like homeless shelters, food and assistance with food security and hunger solutions, and health, evidence-based health information. At the moment, as I said, we're in 8 public libraries. We're hoping to be in 12 by next year. There's 56 public libraries in Suffolk County and slightly more than that in Nassau County. And we would love to expand and partner with other schools of nursing and public health on Long Island to make this available, easily replicated, great learning experience for the students to understand what diverse communities need and how to be an effective communicator and serve as a resource. We've also done librarian trainings, which have, again, responded to the needs assessment that Janine and her team collaborated on to address the needs of librarians who are, frontline workers, frankly. In 2017, there were a half a dozen opioid overdoses in library bathrooms. Think about that. Libraries have Narcan kits. And so the librarians are, again, responding to meet communities where they are. And, their budgets are modest. They're looking for experts to work with them and expand what they're able to do when patrons come in looking for support. So we do have some papers coming out. One that is coming out very soon that I'll share with the collaborative that's about the first year of the Healthy Libraries Program. And Janine has worked on a report with us on the needs assessment. So we'll have things to share, but all of this started with an article that LIHC passed around from Health Affairs on libraries being a place beyond books. And so, it's been quite a journey, but really excited about what we've created to support communities through the public library, the trust that people have in the public libraries, as they should.
Yep. Yes, it's been quite a number of years that we've been working on this, but what's come out of it is tremendous. And again, it's at least a report that we will be able to release in a couple of months. This additional information that can be used by hospitals and counties when they're putting together their community health needs assessments and their implementation plans.
So Janine, we'll ask our public library outreach team if we can work with them on getting the community needs assessment placed somehow on public library websites or the gateway. I don't speak for them. I can just ask and facilitate. That's something that we could ask.
Okay. All right. Okay, so now you've got about an hour of your day back, so that's good. Your morning back. Any other discussion? I know it's kind of hard doing this on Zoom? Because you
I
always-
was just wanted to ask, we're starting to get requests from community partners for flu pods and flu vaccine pods in the community, whether Stony Brook does it or
Mhm.
our federally qualified health center, Sun River, whomever. So I don't know if the LIHC could kind of be a place where if there's flu pods going on, that could be announced or shared so that there's a little bit more coordinating of the flu pods in our counties.
Yeah, we certainly can share that. As long as the information is sent to us, so we know what's going on, we can put together a page on the site and then routinely send out information about the flu pods that are coming up. But
Great.
again, it's, as long as we know what's happening, we're happy to do that. Absolutely.
I have a quick question for Lisa. Do you have any information that I could send out to the social workers that I work with about which libraries are having this wonderful program?
Yeah, so I'm going to put my email in the chat. I'll connect you to the field work coordinator. So there's two parts to this. The school social welfare has social work interns in public libraries alone, and they're in I think about 25 libraries this year. And those students are in for a full year doing their field work. But in addition to that, we also have social workers that are part of our Healthy Libraries team, along with nursing and public health and et cetera. So there's two components. So I think the person that you want to talk to is the fieldwork faculty supervisor. Her name is Leah Topak Walker, and she's a faculty member in social work. But if you send me an email, and I'll put my email address in the chat right now, I will connect you to Leah, and then she can give you the full list where all libraries, but for us, we're only in 8 with the full team. And I could also send that to you by email.
Much appreciated. Thank you so
No
much.
problem.
Thank you. I'm glad to see these connections continue to be made, even though we are relegated to little
And I want
boxes
to add that
on the screen.
the services are completely free. The social work interns do not get paid. They actually are doing it as part of their clinical MSW training. And so it's free to the patrons, and the libraries are thrilled. They love having our students and our teams in the public library.
Wow. Thanks so much, Lisa. Anyone else want to jump in? If not, we'll be meeting again on December 9th. I'll have more information to report on the progress of the Community Health Needs Assessment Work Group. I'll hopefully have some better news about COVID vaccination rates. Good news about flu vaccination. Hopefully that everyone goes and gets their flu vaccine so we can eliminate that complication out of the picture, since COVID is still circulating out there. And we'll know more about booster shots and whether or not the government will be funded, because if it doesn't pass a continuing resolution by September 30th, which is next week, we'll go into default. So let's keep our fingers crossed that Congress can that the two sides of the aisle can work together and get that done. And that's it. Thank you, everyone, and have a great day.
Thank you.
Bye.
Thank you.
Thank you.
Thank you.